This is the Coronavirus Daily Briefing for Thursday, March 19th, 2020. I'm Brian McCullough. Global cases pass 200,000. Italy has the deadliest day in any one country since the crisis began. Conflicting studies on possible treatments. How to look up how much capacity your local health system has for COVID patients. More details on how the disease affects children. And advice on how to preserve your mental health, not just your physical health. I'm going to lead with global numbers today. Italy reported 475 deaths overnight, making that the largest single reporting of fatalities from a single location on a single day since the entire crisis began. In response, Italy has intensified and extended its existing lockdown procedures through the end of March. Italy also announced it has pressed charges against 40,000 people for violating the terms of the lockdown. France says it has issued more than 4,000 fines for violating its lockdown on the first day of that lockdown coming into effect. China, however, finally recorded its first day with 0 new locally transmitted cases for the first time. Confirmed global cases did top 200,000 for the first time as well. GM, Ford, and Fiat Chrysler have decided to close plants in North America under pressure from their labor unions in an effort to protect workers. A worker at a Ford truck plant in Dearborn, Michigan, tested positive for the virus on Wednesday. Representatives Ben McAdams and Mario Diaz-Balart became the first congresspeople in the U.S. to test positive for the disease. The Pentagon is shipping 500,000 nasopharyngeal swabs from Italy to Memphis, Tennessee. These are swabs that can be used to collect cell samples from the back of the nose and throat and are useful in coronavirus testing. The U.S. Census Bureau has suspended field operations until April. 50 FEMA teams will deploy to help state governments deal with their local coronavirus responses. Amazon has confirmed its first case for an employee in one of its U.S. warehouses. The worker in question was employed at a facility in Queens, New York. And speaking of New York, quoting the New York Times, Governor Andrew Cuomo of New York provided new numbers on Wednesday that showed 2,382 people in the state had tested positive for the coronavirus, an increase of more than 800 since Tuesday. In New York City, 1,871 people had tested positive, compared with only 814 on Tuesday. Mr. Cuomo attributed much of the jump to an increase in testing. Of the 14,597 people tested so far, nearly 5,000 were tested on Tuesday alone, end quote. If all of those numbers ran together in your head, the bottom line is this. The state of New York confirmed 1,008 new cases in a 24-hour period. Quoting from the Washington Post, the virus's growth curve suggests that New York could need 110,000 hospital beds and 37,000 ventilators 45 days from now, Cuomo said. The state currently has 53,000 beds and 3,000 ventilators, end quote. Quoting from the New York Times, for the Fusco family of Freehold, New Jersey, the dangers of the virus and its pernicious exploitation of human connection were laid bare when Grace Fusco, 73, died Wednesday night, hours after her son and 5 days after her daughter also died. 4 other family members are hospitalized, 3 of them in critical condition, all from an infection traced to a routine family gathering, end quote. The New York Stock Exchange will temporarily close its trading floor and move to an all-electronic trading operation beginning March 23rd after 2 people working on the floor of the exchange tested positive for COVID-19. The National Institute of Health is looking for volunteers who have recovered from COVID-19 to donate their blood for studies into the response of their immune systems to the disease. Approximately 20% of Californians are now under shelter-in-place orders, or a total of 9 million Californians. Britain finally announced that it would close schools beginning on Friday, but exceptions will be made for the children of parents who work in healthcare, the police force, or even supermarket delivery drivers. Classrooms and supervision will remain available to those children so their parents can work. The London Underground subway system is taking steps to reduce the usage of subway service in the city. 40 stations have been closed and bus service is being reduced. Japan's northern island of Hokkaido has lifted its coronavirus state of emergency after infections there were reportedly brought under control. However, this is proving controversial. Meanwhile, Australia and New Zealand are moving to ban entry to those countries by all non-citizens and non-residents. And finally, that chart from the Financial Times showing the trajectory countries are on in terms of the growth of cases has been updated. Link in the show notes. TLDR, it looks like most Western countries seem to be on the Italian trajectory. Government researchers in China have announced that a Japanese flu drug has demonstrated effectiveness at treating coronavirus in 2 clinical trials. Zhang Jinmin, director of China's National Center for Biotechnology Development, told a news conference in Beijing yesterday that the anti-flu drug favipiravir, also known as Avigan, quote, has a high degree of safety and is clearly effective in treatment, end quote. Quoting from Japanese state broadcaster NHK. He said the medicine worked for coronavirus-related symptoms, including pneumonia, and had no obvious side effects. The director said the tests were conducted in the cities of Wuhan and Shenzhen and involved 240 patients and 80 patients, respectively. He said those who were given the medicine in Shenzhen turned negative for the virus after a median of 4 days after becoming positive, while it took a median of 11 days for those without the drug. The trial also found that X-ray photos confirmed improvements in lung conditions in about 91% of the patients who were given the medicine. The number stood at 62% for those without the drug. The director said the drug is highly safe and its effect is obvious, and formally recommended the use of the medicine as a way to tackle the virus, end quote. But countervailing news from a report in the New England Journal of Medicine, which says that antiviral drugs that it had been hoped would help combat the disease failed in the first major study of those drugs in seriously ill patients also in China. Quote, no benefit was observed, the researchers wrote. ProPublica has created a tool, which of course we have a link to in the show notes, where you can plug in your local region and get an understanding of what sort of capacity your local hospitals might have in different scenarios involving coronavirus. The results across the country are clear. Dr. Ashish Jha, who led the team of researchers that developed the analysis, told ProPublica that in most scenarios, quote, vast communities in America are not prepared to take on the care of COVID-19 patients showing up. Dr. Jha added to the New York Times, if we don't make substantial changes, both in spreading the disease over time and expanding capacity, we're going to run out of hospital beds. And in that instance, we will not be able to take care of critically ill people, and people will die, end quote. In the very best case scenario, which involves rapid and widespread social distancing, the infection rate holding at 20% of the U.S. population, and those infections being spread out over 18 months, America's hospital beds would still be about 95% full, assuming no new capacity was added. In a scenario described as moderate by the study's authors, 40% of the U.S. adult population gets infected over the course of 12 months, and in that case, quoting from ProPublica, more than a fifth of all cases will require hospitalization. To treat all hospitalized patients over that time, the country would have to more than double available hospital beds by freeing up existing beds or adding new ones, end quote. The situation, even in that moderate scenario, becomes particularly acute with respect to ICU beds and access to mechanical ventilators. Quoting again from ProPublica, if that moderate estimate holds, about a fifth of hospitalized patients, or nearly 5% of those infected, would become critically ill from COVID-19 and would need intensive care, such as the use of a ventilator. If all existing ICU beds are freed up for COVID-19 patients, the total capacity would have to be increased 74%. And even then, hospitals may have a limited supply of ventilators and specialized staff who can care for extreme cases, end quote. And a particularly sobering number comes when examining the worst case scenario, in which 60% of the adult population gets coronavirus within 6 months. In that case, ProPublica says the nation would require more than 7 times the number of available hospital beds than it currently has, end quote. That's the other powerful thing with this tool. Plug in your locality, and you can get an estimated number of the number of coronavirus patients hospitals would receive in your area over moderate or worst case scenarios over a 12-month period. For example, for the county in Florida where my parents live, The estimated number of total cases over 12 months in a moderate scenario was 96,000. My mom said to me just this week that she was sad because she can't send the grandkids care packages for St. Patrick's Day or Easter because she can't go to the post office or the shipping place anymore. I told her, and I swear I am not making this up, there is a solution, Mom. It's Stamps.com. Anything you can do at the post office, you can do via Stamps.com. Their on-demand postage means you can skip that trip to the post office, which, of course, is something we should all be doing right now, skipping any trips outside that we can avoid otherwise. With Stamps.com, you can simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. Once your mail is ready, just leave it for your mail carrier or drop it in a mailbox. It's that simple. There's no equipment to lease. There are no long-term commitments. Right now, listeners to this show get a special offer that includes a 4-week trial, plus free postage and a digital scale without any long-term commitments. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com. Enter briefing at the top for your free 4-week trial. We did a bunch of tweet storms yesterday, especially the ones involving people's personal experiences when they've actually come down with COVID-19 infection. But as the strain is starting to really hit our healthcare system, I also wanted to share some stories about the true heroes right now, the frontline healthcare workers. I'm sure we'll start to get some horror stories in coming days, but for now, here are some actual no BS profiles in courage. Kristen Fisher is a correspondent for Fox News. Late Monday night, she tweeted a picture saying, quote, "This is my dad. He's a 73-year-old emergency room physician in Texas who loves his job and will never retire. He texted me this picture tonight after I'd asked him how he was doing, and I burst into tears the second I saw it. My reaction came out of nowhere," end quote. The picture, again linked in the show notes, was of her father with a mask on and his physician's coat and stethoscope, suited up to go into battle with the virus. Continuing, quote, "I'd been watching Narcos and laughing seconds earlier. I called him to say I was worried about him, but could barely speak as I fought to keep my voice steady. I think we all have a moment where the gravity of what's happening finally hits us. This was mine," end quote. The responses to this tweet flooded in. The entire chain is in the show notes, but let me share just a couple more responses. Quote, "Mine was nearly identical. My daughter is a charge RN at a local hospital. They have one confirmed patient and 2 others tested inpatient on her floor. She called me Sunday night to tell me, 'Mom, it's not a matter of if I get it, it's a matter of when.' She told me she loved me, but we needed to plan on FaceTime and playing games online. My grandkids can't come over. I suffered a respiratory injury 6 years ago and am high risk. I'm single, and those kids are my everything. I know she's right and trying to accept, but can't quit crying," end quote. And one more, quote, "My daughter is in charge of a large clinic. She has 2 kids. I begged her to find a way to quarantine. She said, 'Mom, I'm a nurse. My staff are on the front line. I would never abandon them or our patients.' People, she's the norm, not the exception. True American heroes," end quote. A new study published in the journal Pediatrics has confirmed that kids are getting infected with coronavirus, even if the disease tends to present with milder symptoms, if any, in these littlest of patients. The study looked at 2,143 cases in China reported in January and February and found that more than 90% of all cases in children were asymptomatic, mild, or moderate. But, quote, "younger children, particularly infants, were vulnerable for more severe disease." So what does coronavirus look like in kids? It seems to present slightly differently from the well-known adult symptoms of dry cough, fever, and shortness of breath. Quoting from the Washington Post, "Mild cases, around 52%, were marked by the typical symptoms of cold, fever, fatigue, cough, sore throat, runny nose, and sneezing. Some patients had no fever and only digestive symptoms such as nausea, vomiting, abdominal pain, and diarrhea. Those children with moderate infections, 39%, had pneumonia with frequent fever and cough, mostly dry cough, followed by a wetter cough. Some had wheezing, but no obvious shortness of breath. Severe cases in children were rare, around 5%, as were those who required critical care, around 0.4%. The severe cases began with early respiratory symptoms, which were sometimes accompanied by gastrointestinal issues. Around 1 week, the children have more difficulty breathing. Those cases sometimes quickly progress to critical illness with acute respiratory distress or failure, which in turn sometimes led to other organ dysfunction, heart failure, or kidney injury, end quote. Again, for whatever reason, those severe cases seemed to disproportionately affect the youngest of children, especially infants, which the study characterized as being particularly vulnerable to COVID-19 infection. It's not known why, though Dr. Andrea Cruz, associate professor of pediatrics at Baylor and co-author of a commentary accompanying the study, told the New York Times that it is likely because, quote, they haven't been exposed to viruses before and therefore can't mount an effective immune response, end quote. The study also suggested that kids overall may experience fewer severe cases of COVID-19. Remember, 90% of cases were asymptomatic, mild, or moderate, because ACE2, an enzyme known as a cell receptor for the virus, may have a lower binding ability in children compared to adults. However, the specific symptoms experienced by children, runny nose and gastrointestinal symptoms especially, mean they may have an outsized role to play in community transmission of the virus. Dr. Cruz and Dr. Steve Zeichner wrote in their commentary accompanying the study, quote, prolonged shedding in nasal secretions and stool has substantial implications for community spread in daycare centers, schools, and in the home, end quote. Finally today, as the number of coronavirus cases ramps up and as more lockdowns and social distancing measures are put into place across the U.S., more and more people are no doubt feeling the psychological effects of the pandemic. Joshua Morgenstein, chair of the American Psychiatric Association's Committee on Psychiatric Dimensions of Disasters, said in the Washington Post, quote, right now people are feeling grief over the loss of routines, certainty, and a perception of themselves as being generally healthy and protected, end quote. To help treat the feeling of grief, Morgenstein recommends, quote, things like getting good sleep, eating regularly, staying hydrated, exercising. When we take care of our body with good sleep in particular, but certainly food and water, our ability to think clearly, our ability to solve problems, our ability to manage our emotions are all optimized, end quote. Kathy Hogan-Bruin, a Washington-based clinical psychologist specializing in anxiety disorders, also recommends not following every single update about the coronavirus if you're already feeling overwhelmed. Quote, really try to limit the news consumption or just staring at your phone and your computer because for most of us, that makes mental health worse rather than better, she said. Joshua Gordon, a neuroscientist and psychiatrist who is the director of the National Institute of Mental Health, recommends making a plan for dealing with this moment. Quoting the Washington Post, having a strategy for day-to-day living isn't just a matter of protecting oneself from the coronavirus and limiting its spread in the community. It's a form of mental therapy, as Gordon sees it. A pandemic plan could involve ensuring that social distancing doesn't result in extreme loneliness and a feeling of isolation. People who are staying home can set up group chats via Zoom or FaceTime or some other platform. Make a plan for helping people who are most vulnerable, or at least making sure that someone is checking in with an isolated elderly family member each day, something Gordon's family has been doing, end quote. Gordon says, quote, remember that what is most disturbing about what we're going through is the uncertainty. When we know what's happening, when we know what to expect, we feel safe, even if what we expect might be threatening. Develop a plan, find your place in the world. It can take time, it can take preparation, but it can help a lot, end quote. While we all might be feeling some form of distress during this time, it can be particularly rough on the 1 in 5 Americans who experience some form of mental illness, and an interruption to daily routines, lack of social engagement, and the uncertainty of the future can worsen symptoms. Psychiatrist Joshua Morgenstein says, quote, it's like this kind of forced depression. No one knows, can I go on summer vacation? Can I go to my daughter's graduation? We don't get to do that planning and daydreaming in our heads right now. Depression is feeling hopeless about the future, and right now I think that's how a lot of people feel, rightfully so. If you have underlying depression, that might be exacerbated at this point, end quote. Even if you don't experience anxiety or depression, usually this kind of crisis might cause you to have something called distress reactions. Morgenstein explains distress reactions as, quote, trouble sleeping, difficulty in concentration, a feeling of being unsafe, anger, blaming others, a desire to socially isolate. It can lead to risky behaviors such as excessive use of alcohol or tobacco. Interpersonal violence can flare. One common response to disasters is work-life imbalance, working long hours and letting other important duties and needs in one's life slide, end quote. If you are feeling any of those distress reactions, listen to the advice of experts that I just listed. Schedule time to check in with friends and loved ones. Eat healthy. Exercise. Get fresh air if you can. Stick to a schedule. Make a plan. All of that can help you manage and stay calm. And maybe this closing reminder from Joshua Morgenstein about the universality of this experience will help. Quote, understanding and reminding ourselves that we're all going through something together, sometimes that can help us feel less alone, end quote. As always, this show was produced by Ride Home Media, written by Brian McCullough, James Welsh, and Jackson Bird, edited by James Welsh and Jackson Bird. If you're finding this show useful, please tell your friends and family that they should listen too. We will talk to you tomorrow. Be well.